Yoga is a gift of ancient India to the world, has become a way of life for millions across the globe. The enthusiasm for yoga transcends barriers of age, gender, faith, and borders. Yoga is a way of life, an experiential science of human nature that enables us to realize our real selves. Today, we have an interesting panel comprising of experienced experts to enlighten us on the scientific dimension of yoga. With this, I would request Ambassador and Permanent Representative of India, Mr. Rajiv K. Chander, an accomplished diplomat with a rich and varied experience, to deliver his welcome remarks. Ambassador Chander, please, you have the floor now.
Thank you, Animesh. Dr. Swaminathan, Deputy Director General. Dr. Naoko Yamamoto, Additional Director General, Health Systems and UHC, WHO. Distinguished panelists, presenters, meditation experts, Indian Association of Geneva, ladies and gentlemen. I welcome you all to today's symposium, Yoga for Holistic Health, which the Permanent Mission of India is organizing with the WHO. And I wish to thank Dr. Swaminathan for her presence and also for the excellent cooperation that we've enjoyed with WHO in putting this event together. And incidentally, this is the first time ever that we're having an event at the WHO which is linked to the UN International Day of Yoga. Now, as you would be aware that India's initiative in December 2014, the UN General Assembly had proclaimed 21st of June as the International Day of Yoga. And it is interesting and relevant to note that the resolution refers to the 2011 political declaration of the high-level meeting of the General Assembly on the prevention and control of NCDs. The resolution also states that yoga provides a holistic approach to health and well-being, and that wider dissemination about its benefits would be beneficial for the health of the world population. Now, in India, the Department of Science and Technology has brought out a new research program called Science and Technology of Yoga and Meditation under its Cognitive Science Research Initiative. This new program is aimed to foster scientific research on the effects of yoga and meditation, on physical and mental health, and on cognitive functioning in healthy people as well as in patients with disorders. Interest in the science of yoga worldwide has shown an exponential increase in recent years. In June 2017, the European Union funded a research project to coincide with the International Day of Yoga 2017 to better understand yoga and its benefits. The project collaboration agreement, which was signed between the WHO and the Government of India, and in fact, within the Government of India, we have the Ministry of Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Homeopathy. Now, this program will run from 2016 to 2020, and the projects which are included in this collaboration include benchmarks for training in yoga and for practice in Ayurveda. Now, Dr. Geetha Krishnan, who is here today, is the technical officer in the TCIM unit, I believe it's called, and who has played a pivotal role in organizing today's event, and he's on secondment to the WHO under this program. So I wish you all a very happy International Day of Yoga. I wish to thank WHO again for the very first event being hosted under the rubric of the International Day of Yoga. And I do hope that this would be the first of many such initiatives that we will be celebrating in future. Thank you very much.
Thank you for your insightful words, Ambassador. Now, I would request Dr. Soumya Swaminathan, Deputy Director General, Programs of the World Health Organization, and a globally recognized researcher on tuberculosis and HIV, to deliver the welcome address. Dr. Swaminathan, you have the floor.
Your Excellency, Ambassador Rajiv Chander, distinguished guests, and especially our guests who have come specially for this occasion, Master Sunita and Dr. Suman Kolipara, as well as Professor Ali Zamir Khan from the UK, and our distinguished panelists. So it's my pleasure to welcome you all to this afternoon, and as Rajiv ji just mentioned, this is quite a unique, I think it's the first time that we are having something like this. And while it's not the traditional demonstration of yoga or which we would have very much liked to have, and we will see whether we can organize a session in the coming days with Master Sunita ji. But today it's more about talking about the benefits and really on the scientific evidence behind yoga. I would also like to thank on this occasion the Indian government for having participated and supported in the Walk the Talk Health for All Challenge event that was held just before the World Health Assembly, where we had our health minister there, the Indian health minister participating, but we also had a number of people doing yoga in the at the Place de la Nation, and I think that was a very nice demonstration of the benefits of yoga for health. Yoga is unique because it provides a very holistic approach to health and well-being. It's not just the physical exercise, but it's really a lot to do with spiritual, and we'll hear more about that today. The term yoga itself comes from the Sanskrit root word yuj, which means to unite, uniting the subtle with the gross and the microcosm with the macrocosm. Just like other philosophies, traditional ones, like we have the Ubuntu and the Nahua, you have Native American, as well as the Tao philosophies, yoga believes in oneness of the force, linking the self and all creation. And it also believes that peace, both inner peace and world peace, is a prerequisite for harmony. And this year's theme for International Day was Yoga for Harmony and Peace. The principles of yoga also align with the values of the SDGs to integrate and balance between people, planet, prosperity, peace, and partnership. And it's especially relevant for SDG 3, which is to ensure healthy lives and promoting well-being for all. This concept is also reflected in the WHO's 5-year strategic plan, the GPW 13, which endeavors to address the issues of universal health coverage, of course, but also focuses on promotion of health and prevention of disease. So really going more towards wellness, promoting wellness rather than focusing on disease. Yoga is an ancient system of holistic health and is an important part of traditional complementary and integrative medicine. And I think now we have also for the first time in our department of the traditional complementary and integrative medicine, we also have an expert, Dr. Geetha Krishnan, who is an Ayurvedic physician, and to deal with all the ancient systems of medicine which come from the Indian subcontinent and focus on building the evidence base, just like the Chinese traditional medicine has now a strong evidence base built up. We need to do a similar thing for Ayurveda and yoga. I think as populations are aging, we also realize that we need to adopt more healthy living practices in order to have a healthy lifespan. So while life expectancy can be increased, it's not necessary that you're actually living healthy lives. So we see most people now who are beyond the age, living older. You could go up to 80 years of age or even older than that. But if you have a huge burden of chronic diseases, then it's not a very enjoyable way to live life. So I think the idea and the aim really is not only to increase life expectancy, but to increase healthy life expectancy. And therefore, these traditional practices, of course, diet, nutrition is very important. And in fact, that's an integral part of this whole system. So it's not just the physical exercise, but it's really more a holistic approach. And as Ambassador mentioned, the fact that yoga has been acknowledged under the UN observances underlines it as a living tradition. And it reinforces the need to further explore the wisdom found in traditional knowledge systems to find clues to our contemporary problems that are faced by humanity today. So I think we have a very interesting program ahead with a number of distinguished panelists who have studied this area in depth, and I look forward to listening to them. And I hope that we can also do a little bit of practical demonstration of the powers and benefits of yoga. So thank you very much, and again, thank you, Rajiv, for having organized this, helping us to organize this event here. Thank you.
Thank you for your encouraging and enriching words, Dr. Swaminathan. I would now request Dr. Naoko Yamamoto, ADG Health Systems and Universal Health Coverage in WHO, and an experienced professional who has also served in the Health Ministry of Japan, to deliver her introductory remarks.
Thank you very much, and good afternoon, and Excellency Ambassador Rajiv, Chander, and also the distinguished guest. Thank you very much for giving me opportunity. First of all, I would like to thank you, the Indian government and the mission to work together to organize this meeting. And I think that Soumya has already delivered a key message as WHO. And also, I listened very carefully about the yoga's history and meaning, so I learned a lot from you, next to you. But I would like to say a few words addition to that. Then, first of all, talk about the linkage between public health or primary health care and yoga. The Almaty Declaration, which adopted by WHO and UNICEF in 1978, it was the first recognition of the role of traditional medicine and its practitioners in primary health care and by WHO and member states. And this year 2018, is the 14th anniversary of the Almaty Declaration. And I think that it is a good opportunity to revitalize the linkage between traditional complementary or integrated medicine and public health or primary health care and UHC to draw out the comprehensive strategy for health for all. And WHO, let me introduce a little bit about the WHO traditional medicine strategy, which is 2014 to 2023, in which reviews the potential contribution of TCI and which can make the health and establish the priority action and issues. And it's focused on the three areas. First, as Soumya has already mentioned, that it should be built on the knowledge-based policy and evidence. And the second is quality and safety of the traditional medicine. And the third is integration of the traditional medicine to the health system. And also the health practitioner should serve as a care provider for the community and also the health system. And also we could invite and include the people other decision making of health services as well. So yoga, it's not like it's not like a pharmaceutical treatment or something, but still we would like to think about the safety aspect and conditions, how to use it, and also how to use the yoga for the self-care and community care and clinical care. So, thank you very much. And I would like to hear more about yoga. During the walk and talk day, I'm also joined the yoga, but a little bit painful for me. So I need more exercise for it, but I would like to call the yoga to serve as a useful tool to address complexity of our life and aging our society to be sustainable development. So I'm looking forward to hear from all of you. Thank you very much.
Thank you.
Thank you, Dr. Yamamoto, for your valuable words. We have Professor Ali Zamir Khan amongst us today. Dr. Khan is a leading authority in the field of minimally invasive and robotic thoracic surgery. He is also the founder of Scalpel, an educational center dedicated to training young surgeons across the world. Dr. Khan, now I would pass on the floor to you for your presentation.
Thank you very much. His Excellency, Ambassador Rajiv Chander, Dr. Swaminathan, Dr. Yamamoto, Dr. Zhang, Dr. Geetha Krishnan, thank you very much for inviting me to speak from this prestigious forum. It's indeed an honor and a privilege to be in front of you to discuss our strategies of integrative medicine and to talk about robotic surgery and yoga. The objective of this talk is, number one, to define modern medicine. So I'm going to talk a little bit about robotic thoracic surgery and minimally invasive so that you understand what we do. I'm going to talk about integrative medicine, how we integrated the ancient sciences of Ayurveda and yoga into this cutting-edge modern technology. And I'm going to focus a little bit on the scientific outcomes of our work with yoga. So that's where I want to go. So this talk, I call it 200 BC to 2018 AD and integration. All right. Okay. When I came back, I worked and trained in the UK. I've spent about 20 odd years, and I was fortunate enough to be asked to come back to India to a hospital in Gurgaon, where we set up a cutting-edge robotic thoracic surgery unit. The first thing that hit me about India was, I'm sorry, these slides are not moving accordingly. Which are your buttons? I need to go back. Yeah, this is go back. Stop. Okay. Are you going to change it? Will you change the slides for me? Okay. The first thing that hit me about India was it was such an incredible country of amazing contrasts. We had so much history. At the same time, the country was making so much progress that we had all the latest technologies available to us. Well, I lived in rural Gurgaon, just outside the town. When I got out of my house in the car, I would go past this wonderful wildlife. I would go past these wonderful mustard fields. I would meet my friends on the way and then turn up to the hospital to do robotic surgery. So it was rural to robotics in 10 minutes, and it was just an amazing experience. And that is what we did. I actually coordinated with Dr. Geetha, and we played to our individual strengths to bring out a world-class experience of yoga plus robotic thoracic surgery. The background of my philosophy in life is that nature meant us to turn from a caterpillar into a beautiful butterfly. But in life or in cardiothoracic surgery, if you do not push the boundaries, if you do not go beyond the normal, the chances are you will turn from a caterpillar into a senior caterpillar and stay there all your life. And the aim of this talk is to show you how to turn from a caterpillar into a butterfly. Robotic thoracic surgery, when we talk about surgery on the chest and the heart and the lungs, we conjure up an image of a large cut on the chest wall, cutting through muscles, cutting through ribs, getting into the lungs and operating on them, cutting through the midline and operating on the heart. So I personally, when I trained through an era of these large cuts, a thoracotomy, which was on the side, a sternotomy in the midline, to do all these gory surgeries that we did. I was fortunate enough in England to be one of the earlier adapters of a technology called as video-assisted thoracoscopic surgery, where we made tiny cuts on the chest wall, put in a camera, and did exactly the same operation that we were doing with these large cuts on the chest wall. So these tiny cuts took away the scars, took away the cut to the muscle, took away the pain. So better cosmesis and better outcomes. The reality as surgeons is we are never satisfied with what we do. So we push the boundaries all the time. So with 3 cuts, we then said, why can't we do it with 2 cuts? And then why can't we do it with a single small cut? And technology kept pace with us because the camera started getting smaller and smaller. So now we are in the world of uniportal VATS, which is a single cut with a camera going in and instruments going in. And the same operation happens as you saw with that large cut on the chest wall. We are even started doing this under local anesthesia. So a huge lung cancer in the upper lobe of the lung, we don't need to put the patient completely asleep. We give local anesthesia, we give local blocks, and do the whole operation with the patient awake. This is very, very good for the physiological recovery for the patient. And of course, the next step from there was to use robots, to use robotic surgery to get all these outcomes. Robotic surgery involves docking a robot onto the chest wall and me sitting on a console which is not connected to the main robot and doing all this wonderful work while sipping coffee. All right? The advantage of robotic surgery is that the vision is very good, 3-dimensional vision. My hand stops here where the robot can go 360 degrees around and give me really, really accurate, high-end surgery on very, very complex structures like the heart and the lung. So it is really a good technology. And you can see some of the tumors that we take out. This is a 16 centimeter tumor, which we have taken out through 1 centimeter incision on the chest wall. And obviously the outcome for the patient is better and is good. I wish this works well. In India particularly, I got exposed to a lot of surgery on patients with tuberculosis. Tuberculosis causes a lot of adhesions in the chest, and surgically to operate on a chest with tuberculosis is very difficult. In that scenario, we added keyhole surgery, and then we added robotic surgery, and we have the largest experience in the world on doing TB surgery using a robot, and particularly a particular fungal infection called as aspergilloma, which causes a lot of chaos in the chest. And so this was really a great experience which we've published across the world, and we are recognized for doing this work. So now we come to the fact, where does this practitioner of modern medicine, the so-called modern medicine, where is he talking about yoga? How does he know about yoga? What is he doing? You know, to be really honest, Geetha and I are conjoined twins. Really, the work we do together, we are like conjoined twins. We've put the yoga, Ayurveda, and robotic together, and my patients benefit from a very old technology to the latest cutting-edge technology. It's for the benefit of the patient, and that's the bottom line. So we are like two peas in a pod. So why integrative medicine? Where did it all start? Well, reality is that I trained in the UK in cardiothoracic surgery, but when I came back to India, I had no knowledge about yoga, Ayurveda, Unani, or homeopathy. But the good thing about that was I did not carry any baggage with me. I did not have any cynicism about these traditional medicines. You know, whenever I face a problem in life, for me, I look to nature for a solution. Even when I'm trying to design surgical techniques, I'm trying to design surgical instruments, I use nature. I use an alligator tooth kind of a forceps. I use a dolphin nose kind of a forceps. So why not use the same technology in my clinical practice? It made natural sense to me because yoga and Ayurveda, they are all from nature. There is no adulteration, and outcomes have to be good. How did it start? When I make tiny cuts on the chest wall and I operate, though we have done away with all this cutting of muscles and cutting of fat, the cut goes between the rib spaces, and there is a nerve running along the rib space, which is called as an intercostal nerve, which is a sensory nerve. When these spots heal, they pull on this nerve, and you get a bit of pain, a bit of discomfort for the patient. Not the gross pain that you get with big cuts, but a bit of discomfort. Now, I met Dr. Geetha, and I said, Geetha, you talk a lot about pain, palliative medicine. Can you help me with these patients who are coming 6-8 weeks following surgery with pain? Can you actually help me get rid of the pain? And Geetha said, yeah, absolutely. I can do it for you. No problems. For me, the good thing was the patient was off my back and he was on to Geetha, so less headache for me. But there was nothing to lose because Geetha would try his medicine and I would see how it worked. Now, the reality is that when the patient got pain, I sent him to Geetha. He did 10 sittings with these patients, gave them local oil fermentation. Can this work faster? Gave them local medication. He had all this array of medication, which I knew nothing about. But he also used this therapy couch. He created a well around those incisions on a healed wound, and then he put these medicated oils onto it and gave local treatment for these wounds and these pains. He used what is called as a patra potli. I don't even know the names of these things. The bottom line of this discussion is that the patient came back to me and said, there is no pain now, doctor. I am actually feeling much better. There was psychological benefit because the therapist spent an hour with the patient. I didn't have that time. And the patient could do it at home, and most importantly, the chronic pain cycle was avoided because these things can become into chronic pain. So the next step, we are greedy. We are always greedy. So my next step with Geetha was, Geetha, if you can help me with post-operative problems, can you help me before the problem sets in? Can you help me pre-operatively? And that's where Geetha said, I can definitely help you preoperatively. So we set up preoperative programs where when I see a patient with a lung cancer, Geetha sees the patient concurrently at the same time and designs a yoga protocol. He teaches them every single yoga exercises. There is a protocol for that. And we do preoperative pulmonary function tests. We wanted to have hard numbers to prove that we were making a scientific difference to these patients. We didn't want to just make assumptions. We wanted to actually prove to the world that we would make these differences. So we had a therapist who's actually now part of my team on a ward round. I do not go on a ward round without the guy with me. He is a very much integral part of my team. He teaches the patient meditation, deep breathing exercises. Some of these names took a long time to understand. I didn't even know what they were. But he teaches the patients all these exercises even before they have gone for the operation. So my patients, when they come out of the operating theater, having undergone a very complex supramajor lung surgery or heart surgery, within 4 hours following the surgery, my therapist is there. Whether the patient is in the ICU or in the recovery room, my therapist gets him out of bed, sits up, and starts the exercises. This patient has learned these exercises preoperatively. So postoperatively, it's very easy for him to perform these exercises. Apologies for this technology. The other good thing that we have set up is what is called as an Ayurvedic garden. These are all Ayurvedic trees which are planted in a scientific way around an open area. And this area is actually on the 5th floor of my place. And every single patient of mine, the moment he gets out of bed and he does the yoga exercises, he's taken out of the ICU, out of the recovery room to take a walk down this garden. He gets fresh air and he gets whatever smells and perfumes that you get from this Ayurvedic garden, and his psychological mindset is changed. He's starting to feel better. So we did this with almost 870 cases. We looked at pain scores. These patients come out with a chest drain in situ. We looked at how much fluid is coming out of the chest drain. We looked at postoperative chest x-rays. What is the improvement in the postoperative chest x-ray? We wanted to make sure that the lung was completely expanded. The word atelectasis means a collapsed lung. We wanted to make sure the lung was completely expanded. We did not want pleural space left behind, because when you take out part of the lung, the rest of the lung has to re-expand to fill up the space. And that is where yoga comes into its own. It helps the lung to re-expand and fill up the space and naturally take over the function of the lung that we have taken out. And what we looked at is, if we manage to get all of this, can we get rid of the chest drain next morning? And can we discharge the patient the same day? That is what we were looking at. We also did in the long-term postoperative pulmonary function tests, and we did what is called as a patient satisfaction score using international standard guidelines. So what were the results? The first and foremost, the mood of the patient was elevated. The patient was not depressed following a supramajor surgery. That is the first and foremost thing. We found that the patient's ability to breathe and the pulmonary exercise capacity was improved. We had scientific evidence now to show that we were making a difference in the patient's outcome. The lung, which half of it was taken out, it was a balloon. So the more they blew, the more the lung expanded and filled up the space. The amount of pleural fluid that was coming out reduced dramatically, because now the lung took over the place. So there was no place for the fluid to collect. And more importantly, because I've operated on the lung, I've left a raw surface on it, air leaks out after surgery. The moment the lung re-expands and touches the chest wall, it sticks to the chest wall and the air leak stops. And that is very, very, very important for us. And because of that, the next morning following the surgery, the drain could be taken out. So one admission, early morning, big operation, 4 hours, yoga, deep exercises, next morning, drain out. From my point of view, pain is well controlled, the guy can be discharged. after supra-major surgeries. And this was something that we showed scientifically in our paper, which we published. The key thing is to teach them exercises preoperatively and to get them mobilized postoperatively. And when they are mobilized and they are sitting up, it's much more physiological for the patient, particularly when they want to cough out the phlegm, because phlegm is bad for patients having thoracic surgery, because phlegm is a nidus for infection. We don't want them to have infection in the postoperative period. So the yoga guy directly impacted my incidence of postoperative infection and my incidence of lung expansion. My key aim following supramajor lung surgery is good respiration. And good respiration depends on A, the elasticity of the lung, that means the bounciness of the lung. It depends on the accessory muscles of respiration, and it depends on the movement of the diaphragm. These three things, if I can target, I will get a good patient in the postoperative period. Yoga directly helped, the pranayam directly helped to increase the lung inflation deflation. It improved my chest wall movement, and more importantly, sorry about this, I apologize, it improved my diaphragm movement. So the lung capacity improved. And by improving the diaphragm movement, it actually moved the bowels. The paralytic bowels, which you get with anesthesia, did not happen. The patient could go to the toilet early next morning, and because of that, the respiratory distress was taken away. A direct correlation between yoga and outcomes in clinical surgery. We looked at long-term pulmonary function tests, and we found that there was an improvement in the pulmonary function test in spite of losing part of the lung. There was decreased pain in these patients using pain scores. Most important, the patient satisfaction was very, very high. Because I am so busy, I don't have time to sit with the patient postoperatively and talk to him. My yoga therapist took my place and he spoke to the patient. So my patient love yoga and love Ayurveda. They don't love me as much as they love Geetha. All right? And so that's the bottom line. But what are we looking for? We are looking for good outcomes for the patient. It doesn't matter whether you don't like me or not. The other thing that we were looking at is inflammation and things like that. And we found that the stretch of the lung actually sends an inhibitory signal to the vagus nerve, and it changes the autonomic nervous system, and it reduces metabolism and parasympathetic dominance, which essentially means, these are all complicated words. Bottom line is, what it means is it reduces inflammation in the patient. So the patient recovers faster. So the first phase of following surgery, the inflammation reduces dramatically. And now we are looking at markers of inflammation at a genetic level to prove that yoga is actually beneficial for my patient. We published this in a very, very famous international thoracic surgery journal, which we called 200 BC to 2015 AD. That's when we had published it. The good thing out of this publication that happened is that my yoga physician, which is Dr. Geetha, was suddenly lecturing in front of cardiothoracic surgeons. Lion's Den, okay, a whole bunch of skeptics who don't believe anything. And more importantly, here was a cardiothoracic surgeon who was talking in front of yoga people and Ayurveda people. And, you know, normally I'm used to giving talks in front of 100, 200 people. When I went to the World Yoga Day, there were 15,000 people in the audience with a stadium, and they were all whistling when I said my patients love yoga. And so it's really an amazing experience for us in terms of global integration. Now, there are always challenges in life. Cost, expertise, training will always be a challenge when you set out on something new. But the real change that you need to address is to change the mindset of surgeons, physicians, the lack of education, and the information, and overcome cynicism. That is the most, that's why I travel whenever Geetha asks me to travel. I want mainstream physicians, surgeons to actually try these new technologies. They not new. They are actually the original technologies. How dare we call ourselves mainstream? We are not mainstream. You are mainstream. We just came in the last 100 years. Okay? So it's really wrong for us to do that. What we need is multi-institute, multi-speciality collaboration. We need common research goals. We need to exchange ideas and exchange resources that are available. And this is where I think the WHO will come into its own to help us spread this message, help us start these programs. I am getting requests from countries across the world, UK, China, Taiwan, Hong Kong. They want to integrate their specialty. Tai Chi, I was talking to him earlier, Tai Chi, they want to integrate Tai Chi into their programs. Whichever is your local, art form, use it, but use it for the benefit of the patient. When we started this program, Geetha and I, we just wanted to do one case, small dream, small fish. One fish is all we wanted. We wanted to see, does it work? And for me, I just wanted to get rid of the patient to Geetha. All right? But actually, it's turned out to be an absolute whopper. It has changed lives of people across India, and now we are aggressively pursuing this to introduce this into the UK. And I'm hoping one day Geetha is going to help me with the treatment of, come on, baldness. Thank you very much. Thank you very much.
Thank you, Dr. Khan, for the interesting, educative, and enriching presentation. Next in line, we have a panel discussion coming up on the subject Yoga as a Therapeutic Intervention in Prevention and Management of Mental Diseases and NCDs. I would now pass on the baton to Dr. Geetha Krishnan, Technical Officer in WHO, to introduce the panel and moderate its proceedings. Dr. Geetha Krishnan.
Thank you, Dr. Animesh. His Excellency, the Ambassador, ADG, Dr. Yamamoto, like the respected people around here and dignitaries here. I'm quite privileged to actually introduce this panel and probably trying to moderate this session because everyone who is going to speak are really very, very knowledgeable people on the specific subjects they are going to speak. But I would straight away get into the program because I think we have overshot the time by 10 minutes. Yeah. So I'm privileged to introduce. We are going to talk about yoga as a therapeutic intervention in prevention and management of mental diseases and NCD. That's the subject of the panel discussion, and we expect few questions at the end of the whole session because we would like to bring together all the panelists together, and then probably we could take some questions. But in the beginning, I would like to invite Dr. Saxena. In fact, Dr. Saxena is the director of the mental health program of WHO, and he is a psychiatrist by training and is leading the implementation of mental health action plan of 2013-2020. Like the most important part and most vital part and the most important thing that I'm thankful to him about is he is actually retiring today. It is the last day of his like official work in WHO, and I'm thankful to you, sir, that you took your time for this particular program and came over here. I would like you to take the floor and make the presentation.
Thank you very much, Geetha. Very good afternoon to all of you. Your Excellency the Ambassador, honorable guests, fellow panelists, and other people here, especially from WHO. Whatever I say now will be not as interesting as Professor Khan. So let me start with a bit of a handicap there. But I'm really very happy to be joining this panel, and I also note with a good bit of satisfaction that the name of the panel is Mental Health and NCD and not the other way around. Usually it is NCD with mental disorders in small letters, and sometimes people forget to mention that. mental health and mental disorders are part of non-communicable diseases, and this message is especially to my colleagues within WHO. I will convey it to Dr. Soumya when I meet her next, because that is something that is quite important for us. But more seriously, WHO defines health as physical, mental, and social well-being, and mental and social well-being is again often forgotten. So yoga is one of the aspects which can again bring it back into the discussion of the overall definition of health, overall concept of health. And it is not only theory, it can very practically be done, as amply exemplified by Professor Khan. So I go in the same spirit and describe a few things about mental health, and also about what is possible with the help of yoga, and also what further needs to be done. So let's begin. I have only a short time, so let me see how far I can go with that. First, the numbers. Mental, neurological, and substance use disorders are surprisingly common. We are talking about hundreds of millions of people across the world who have either a serious or a common mental disorder, and the numbers are increasing. So if you see the last column, there is a substantial increase in the numbers even in 10 years period. And of course, partly this increase is because of increasing population and increasing age of the population, but there is also perhaps some real increase. The bottom line is that a very large number of people need help with these disorders. Mental disorders also cause a large amount of disability, which is often not recognized properly. Almost 1/3 of all disability because of all health conditions is because of mental, behavioral, neurological, and substance use disorders. So these disorders kill people, but more often they produce a large amount of disability. And much of this disability is actually during the young period. So if you see this chart, it's the young people between the ages of 15 and 35 where this burden starts and often continues much longer in the life. Let's not also forget that a very large number of people die because of suicide. It's one death every 40 seconds, and overall more than 800,000 deaths every year. And WHO considers suicide as a very major public health issue. In spite of these figures, the treatment that societies provide to people with mental disorders is surprisingly low in the amount of treatment and the coverage of treatment. This slide is a recent slide based on a very large survey of world population. This is about major depressive disorder, which is a very common disorder, and minimally adequate treatment, even in high-income countries, is less than a quarter of the people. And in middle and low-income countries, the percentages are very, very small. Practically nobody is getting treatment in low-income countries for their depression. This illustrates the paucity of professionals and the paucity of their training and the treatment that is provided, which is in the year 2018 is absolutely shameful for World Health Organization as well as all professionals who are trying to help in this area. This is obviously partly because there is less resource, but also partly because of the stigma and the frank discrimination which countries and communities have towards people with mental disorders. So this is the reality that we are trying to correct. In fact, as I keep saying very often, when it comes to mental health, all countries are developing countries, because none of the even high-income countries can take pride in the amount of treatment and the quality of treatment that they're providing to people with mental disorders. This is in spite of the fact that the Sustainable Development Agenda of the UN very specifically says promoting mental health and well-being is part of one of the goals. In WHO, we regard mental health services as ideally being structured in the form of a pyramid. At the bottom, there is self-care and informal community care, which should be available in the largest amount possible. The largest number of people should have access to it, and it costs the minimal. Beyond that, in the middle part of this pyramid, there is the mental health services through primary health care and through hospitals, in general hospitals, and community mental health care, which should be available to people, whoever needs it. Obviously costs more, but should be available in lesser amount because only some people will need that. And at the highest peak of this pyramid, there is the specialist services, which are very expensive. Even high-income countries cannot afford all the services that are needed, but are should be available in a low quantity, provided the bottom of the pyramid is done well. Unfortunately, we are not doing that. Yoga fits very well and very clearly within the bottom part of it, at the minimal. That means everybody should be having some knowledge of self-care, including yoga, and informal community care, which can help a lot. And if we do this well, the need for more specialized services will be decreased. And that's where communities and countries will be more efficient and will spend less money, and people will be happier. I'm very happy that Professor Khan mentioned that the impact on mood is one of the first things that he noticed as an outcome measure. And this can perhaps be replicated in a very large number of areas, whether it's treatment of physical disorders, it's treatment by surgery, it's treatment for non-communicable diseases, HIV, and many other conditions. So this is exactly what we need. Unfortunately, most countries and communities are not doing that. We of course need evidence. We are sitting in WHO, so we cannot recommend treatments or interventions that are not evidence-based. But there is a larger amount of, increasing amount of evidence which is being collected. Even on a very cursory review of literature, and the two articles that I'm mentioning are both from 2018, very clearly demonstrate, and this is a review of 11 studies having almost 1,000 participants, that Sahaj Yoga, which is a variety of yoga, may reduce depression and possibly anxiety. And obviously the recommendation is that more high quality randomized studies are needed. And another study suggests something similar. It's also published in a recognized journal, that yoga for anxiety, basically reviewing the evidence from 8 RCTs into a few hundred subjects, that yoga is an effective and safe intervention for individuals with elevated level of anxiety. So the impact on the mood, especially anxiety and depression, can be very large. The impact on anxiety and depressive disorders could be also there. More studies obviously are needed for that. So how do we go forward, especially within WHO and also in general? We need a few things. There is obviously a varying level of evidence also for some other disorders like post-traumatic stress disorder, which is quite common, substance use disorders, adjustment disorders, headache disorders, improving quality of life of people, improving subjective well-being, also in some cases maybe improving productivity, which ministers of finance will be quite interested to know, besides the ministers of health. What is needed is high-quality studies on larger samples. I'm sure a very large number of people are practicing yoga and meditation, but there is a lack of good studies on these people to suggest that what is effective and what is not. We also need standardization of yoga interventions, because there's a wide variation between what yoga means, and we need to really think about what standards can be there. We need a proper analysis of various components of yoga, because it's possible that yoga is a big package where some things are more evidence-based, more effective compared to others, and we need to analyze that. We need a very careful selection of outcome measures, and I was very happy to hear Professor Khan very clearly specifying what are the outcome measures. And we need that kind of science into mental disorders to say, what are we really measuring which can show a change? And of course, we also need comparison with other evidence-based interventions so that we can stand on our own 2 feet and say, here is the evidence which is comparable to or better than other interventions which are well recognized to be evidence-based. So that's what I have to say, but I am again very happy that at least the discussion has begun, and hopefully in the coming months and years, WHO will be more active. We have, of course, an increased capacity in this area now, and we will be able to chart our way forward for using what we know and to gain more knowledge so that we can disseminate it to many other people, especially and very specifically to people who are skeptics, which are plenty. Thank you.
Thank you, Dr. Saxena. In fact, I'm sure that the pyramid which you show, the lowest part of it, where maximum number of people need to be taken care of, yoga is the right tool. But as the strategy document of the traditional medicine says that the maximum number of countries were asking for evidence for traditional medicine, as you rightly suggested, we require to prepare ourselves for creating more evidence. And I'm sure that in the coming years, probably like mental health department will also be part of activities related to traditional medicine, and we should be able to do some quite good work in that area. Now I would like to invite Dr. Cherian Varghese. Dr. Varghese is the coordinator for management of non-communicable diseases at WHO. And I would like to, he is going to speak about how traditional medicine, especially yoga, could be utilized in the improvement and prevention of NCDs.
Thank you, Geetha. His Excellency Ambassador Rajiv Chander, respected panelists, ladies and gentlemen. Since mood is the most important thing, I don't want to disturb your mood by going into a long presentation. Non-communicable diseases, as we heard already, is the biggest killer in the world. Of course, mental health is part of that, Shekhar. So that is, and the important measure that we need to remember is the premature mortality. It is the number of people dying between the age of 30 and 70 years, which is a major sort of loss to labor productivity, loss to health, loss to the economy of the country. We are not saying that in old age people can die of NCDs, but the global target is to reduce premature deaths from NCDs. And the numbers are massive. Even if you are going to clone Dr. Khan and going to operate on everyone, you are not going to reach that number of people to be operated, which means that we need to think of preventing people from getting non-communicable diseases. Non-communicable diseases, essentially cancer, heart disease, diabetes, chronic lung disease, does not happen overnight. They happen over a period of years, decades rather, starting with people who are healthy. They develop risk factors, they go into high risk, they develop NCDs, they develop complications, then Dr. Khan comes and operates them, then they get into pain and palliative care, and then most of the countries put a lot of money at the lower end of that spectrum. But what we need to do is to start with good public health policies and health promotion, and that is where I think yoga first comes in. If you remember the word illness and wellness, how does the word illness start? It starts with I. How does wellness start? It starts with we. And that is what yoga is all about. It is bringing people together. It is bringing that harmony. And that is very important for people not becoming people with risk factors, which is tobacco, alcohol, unhealthy diet, etc. So even if they have high blood pressure, a bit of asthma, some raised blood sugar, maybe a diabetes, a good primary care healthcare can still prevent them from ending up with a heart attack and a stroke. And that is again a place where yoga can really help in getting people to control their blood pressure and blood sugar and preventing complications. Once it gets into complications, major complications, as you heard from Dr. Khan, there are a lot of places where yoga can actually help in preoperative care, postoperative care, and most importantly, a large number of people unfortunately will die from non-communicable diseases. Quality of death is very important. We always talk about quality of life. And if we want good quality death, I think that again needs good palliative care. Let me illustrate. Look at this person. So if we take such an average person in an average country in the world, usually the blood pressure is high. The person will be a smoker. Lipids will be high. Sugar will become high. And liver, there will be some problem. And maybe even an early indication of that the person will have heart disease. And the person will be depressed. So Shekhar, it is very much on top of, mental health is on top of NCDs, not just part of NCDs. In such a person, it is very difficult to control all these factors because the person will be almost taking 23 tablets a day to cover all the risk factors. And counseling is what is proposed, but we know that counseling has limitations, and I would think a good yoga program can actually help this person to really do well in controlling many of the risk factors. So when we look at the evidence for yoga, I will show in the next slide a little more detail. There are lots of studies on cardiovascular disease showing the impact of yoga on blood pressure. Depression, Shekhar has already shown. Diabetes, when people are randomized to yoga versus routine care, the people with yoga seem to have less of more BMI, and weight gain is less in them. Even in early cancer, cancer-related fatigue, which is a major issue, and you know that people going through cancer chemotherapy go through substantial mood problems as well as physical problems, and maybe some sort of simple yoga might be very useful. Respiratory diseases is an area where there is a lot of studies on yoga, including looking at pranayama in asthma and chronic obstructive pulmonary disease. So two of the major areas that we looked at in the research with the help of my intern Sanjana, who is here, who is an upcoming medical student, so it is people are getting oriented to this much early, is that if you look at 2,170 patients in these 13 non-randomized and 12 randomized trials, randomized to yoga and standard care, the average decline of 0.5% of HbA1c, which is a measure of the control of blood pressure, over 4 to 12 weeks could be demonstrated. That is a very objective way of quantifying the impact, which is usually not seen. Most of the time we say subjectively the person is feeling well, etc. But these are biochemical parameters that are shown to change with a randomized intervention trial of yoga and standard care. Similarly, in hypertension, as I said, which has got much larger numbers of patients under various studies, 39 cohort studies, BP reduction substantial, up to 25 millimeters of mercury in systolic blood pressure and 25 millimeters in diastolic blood pressure. I don't think any kind of tablets will be able to bring down that level of reduction in blood pressure. Of course, this may be in highly controlled settings where people are really getting substantial yoga interventions rather than a very loose provision of yoga as one of the additional interventions. So such a person with all the control of risk factors could get into somebody who is healthy, wealthy, and also with less depression, and can make a lot of difference. This is not a new medicine, because if you look at diabetes, which was mentioned in Susruta and Charaka Samhita, which are written in 300 BC, diabetes is mentioned as madhumeham. You know what madhumeham is? Madhu means honey, meham means urine. That means it is sweet urine. And in that text, it is written that it is either due to the seed or due to the soil. That means it is either genetic or environmental. In 2018, in this building, do we know anything more about diabetes? No. So most of these are very much relevant, but the unfortunate part, as Shekhar repeatedly said, is that anything without test, tablet, and technology is not proper. Anything with the test, tablet, and technology is something good, something that we can do. So I think that kind of a mindset change is very important to know how these interventions can come in. But I think my takeaway slide is very similar to what was presented for mental health. We need more studies to identify the impact of yoga in specific NCD prevention and control. We need to have diagnostic categories and interventions to be well defined so that we can say compare yoga interventions and conditions in the traditional medicine across different populations, systematic documentation of yoga interventions, and how to apply yoga in different settings. And for the information, Tammy, my colleague, is there. She told me that about 8 yoga sessions are happening in WHO every week. So it is not that WHO has not taken it up. Maybe not a formal meeting, but a lot of WHO staff do practice yoga. So with that, I think, thank you, everyone.
Thanks so much, Dr. Varghese. In fact, we had many discussions regarding how to inculcate yoga into NCD and NCD management with him, and I had found him to be very receptive to the idea of bringing yoga together with other interventions into the public health. But what we lack, as he rightly pointed out, is we lack evidence to actually say that it should be a part of big government programs. In fact, I know that there are few centers across India where yoga is being actively looked at by the government in the public health as a part of intervention to prevent especially diabetes and hypertension. So we have to yet look at the data from the results of it, but probably there could be some good leads for WHO to follow up that across the globe. Now, I would like to invite Dr. Chi. Dr. Zhang Chi is a coordinator of the traditional complementary and integrative medicine unit, where I work as a technical officer. Dr. Chi has been the coordinator of the unit and leading it since 2009, and has considerable experience in bringing together traditional medicine to the benefit of the human community. And he has done a lot of work with most of the governments across the globe. I invite Dr. Chi to give his views about it.
Thank you, Geetha. Honorable Ambassador Rajiv Chander. So, colleagues and ladies and gentlemen, good afternoon. So, I understood that for my role as a panel member, just main task is some answer questions and also learning from the honorable experts and my colleagues from other teams. So I didn't prepare the slides. But basically what I would like to say, what we are doing as our program of traditional medicine, complementary medicine, and integrative medicine program on traditional medicine in general, and also what we are doing on yoga specifically. As Naoko, the ADG mentioned that our program currently is focusing on the implementation of WHO traditional medicine strategy, 2014 to 2023. Actually, later this year, we are going to prepare secretary report, midterm report of the implementation. This strategy is a comprehensive one, covering the policy side, research, quality, safety of practitioners, practices, and herbal medicine products. So that's also the appropriate integration, the good models in the countries, and also the self-care by the consumers at home. So that's a comprehensive strategy. So basically, we are working in also comprehensive the approach. For example, quality, safety, effectiveness category. We developed several categories of standard norms and technical documents. For example, first one is terminology and classification. Ayurveda, Unani, Chinese medicine, different forms of terminology, classification. We see that essential standard norms or technical documents in traditional medicine. Otherwise, globally, they use different terms for the same thing, or for same term for different things or different definitions. We cannot work talking about international collaboration on research or training. Second category is the benchmarks for training. So our colleagues already mentioned that qualified practitioners capacity, that is also key for traditional medicine. So we developed the many benchmarks for training in different forms, the Ayurveda, Unani, homeopathy, naturopathy, osteopathy, Chinese medicine, Thai traditional medicine, different. Right? We developed the third category is benchmarks for practice in different modalities, not only training, but practice, like already said, yes, the procedures or standardized approach. That's also important for different categories. And also we developed many guidelines on herbal medicines products in collaboration with colleagues in essential medicine department. So that's GMP, GACP, and quality safety, many we handled. We are going to develop next category is clinical guidelines, focusing on different disorders, conditions, or diseases. So that's our current work. We also organized expert team to work together with member states, identify good models. We're talking about integration, traditional medicine into the health system, particularly health service in each country. As you know, majority countries have their own traditional medicine, more or less. India, Ayush, several major forms. In China, Chinese medicine, but still 35 ethnic minority medicines in China, Tibetan, Mongolia, etc. Right? In a small country, the American region, they told me that in that country, about 200 community-based traditional medicine, which is different knowledge among the different community. So you can see that. So we always say traditional medicine is diversified globally. So how to support countries? Of course, it's a huge task. So for today, we are talking about Ayurveda yoga. There is not only long history, but very well documented, very well educated, right? From bachelor degree to PhD already. So this traditional medicine category different with that only community-based traditional knowledge practice, no documentation, no education. So that's the nature of traditional medicine. So what we are doing now on yoga, as the already indicated, we signed, WHO signed the agreement with Youth Ministry of India. So yoga benchmarks for training in yoga is one of the collaborative activities. So now in the midway of the development of that document, WHO also designated the research institute in Delhi as a WHO collaboration center working on yoga. So a lot of research conducted. So our colleagues already presented some, but a lot of more there, and also some training programs at collaboration center working with our regional office colleagues. Also, they are going on, so which supported us. So what we are going to do in the coming years, particularly supporting implementing the WHO 13th GPW and contributing to US. On yoga, we are going to also develop benchmarks for practice in yoga. So not only training. The training is different entries. Someone from beginning, someone already practice need to upgrade, someone health professionals need to learn this knowledge. So there are different entries for training. But for practice, as colleagues said, yes, maybe we need some kind of standard approach, procedure side and safety side. On the practice, we are going to develop that one. Secondly, WHO released the reference list of core healthcare indicators early this year. So the first time included 2 indicators as additional indicators for traditional medicine. So one of which is that pain management by traditional medicine or integrative medicine. So already some studies reported, even colleague from UK today presented for pain. But of course, the pain is different pains, right? Headache, neck pain, or joint pain, or low back pain, and different causes. So that perhaps is still one of the big topics in the future. By yoga itself, by yoga plus other traditional medicine knowledge and practices, or yoga together with other allopathic conventional medicine together to reach the maximum, the better outcome. Of course, others, the NCDs, so other, from prevention to health promotion to some therapeutic integrative massage, even rehabilitation and palliative care. So a lot of potential. And the proposed activities, we are going to update one WHO guidelines on consumer education. So we also consider to include like yoga, that kind of intervention into that update consumer education, because that we always saying that traditional medicine, a lot of big portion traditional medicine compared to allopathy to be used by consumers at home for self-care. So how to ensure that kind of safety and quality for the self-care, that's also very important, that consumer education and empowering the consumer. So that's our current the work plan. So happy to answer any question.
Thank you, Dr. Chi. In fact, we could take some questions. Do we have time? We could take some questions to the panelists. Probably. Yes.
Thank you very much. Excellent panel. I have one comment and one question. My comment is that undoubtedly we need more evidence for yoga and impact on health. But the available evidence itself, I think, is very compelling that there is definitely an impact on the quality of life in general. I mean, it is, for me, it's common sense. You know, we don't say parachutes save life because everybody knows parachutes save life. So from that point of view, yoga is really holistic medicine, as Dr. Swaminathan mentioned as well. WHO launched a global patient safety challenge on medication without harm last year. And polypharmacy is one of the key areas which we have to target. So my question is there any evidence that those who take multiple medications, can yoga reduce the number of medications these patients are taking? I don't know whether there's evidence on that or not, because polypharmacy is a major issue for safety of medications when patients have to take 5 or more medications, and there are major issues of drug-to-drug interaction. So is there any evidence that yoga practice actually has demonstrated reduction of need for medicines in patients who need patients with multimorbidity or patients who require multiple medications? And that actually includes over-the-counter and traditional medicines as well.
Well, I'm not a yoga expert, but I have been reading a lot about this topic, and I was fortunate enough to attend a talk a few months ago from a cardiologist in the US who presented his own experience and then has actually published outcomes in cardiac diseases with yoga. And his own experience was that he had coronary artery disease, had stents put in, and was on a whole gamut of medications. And then he went down the route of yoga, and his medications are down to 0. And that's been for the last 8 or 10 years. He's not taking any medication. That's not scientific, but that's just a personal experience. He's actually published the role of yoga. I don't remember exactly which journal, but it has been published that actually the number of cardiac medications that you take the moment you start doing yoga goes down, particularly in terms of hypertension and in terms of diabetes. They're saying that there is some direct effect. I may not be able to quote that journal off the top of my head, but if you Google it, it will be there.
Evidence?
Yes, it is anecdotal.
So I haven't seen like a published report or anything, but in my last 12 years of journey of many patients who come to practice Sukshma meditation, we have seen people suffering with anxiety, depression, even panic attacks, like Professor Ali Khan said, hypertension. They have reduced their medication and completely weaned off medication after practicing yoga and meditation. Even though we haven't published any of the papers, but on first-hand basis, I have seen it with many people.
Thank you. In fact, if you look at the systematic reviews which are presented, there are studies which are lasting few months comparing interventions with medications compared to yoga. And the people with yoga seem to have relatively good metabolic profile. The challenge with polypharmacy, as you rightly said, is that there are underlying multiple pathophysiologic processes. So unless yoga is able to get the internal pathophysiological processes leading to lipids and blood sugar and cholesterol and other things to a larger degree, then we may not be able to say exactly. So it needs to be a lifelong practice. At least few years are needed to make sure that internal changes happen. Otherwise, it is like the yo-yo effect. Something you do, the weight is lost, then we reduce the blood sugar and tablets are less. Within 1 month, everything comes up. The thing that I have seen mostly in terms of reducing medication is in some sort of pain. where a well-practiced yoga seems to have shown that the number of pain medications may get less. But the other pathophysiological processes, we need longer-term trials to see.
In fact, there are enough studies which has been published in major journals which suggest that yoga can be an intervention which can reduce the requirement of antihypertensives and anti-diabetic medicines. So there are publications, and there are quite a few of them, especially in Indian journals, but major international journals have also published it. Only thing is that we need to Google it with specific words. They are very, very commonly used and commonly referred to. So there are large number of studies, and if you take a meta-analysis of it, probably it could go to thousands of patients, and it is definitely there, especially in these two areas, hypertension and diabetes. These are the two areas where there are maximum number of studies available.
Just wanted to bring up as well, there's some studies on yoga and back pain, and I know in the UK the National Institute of Clinical Effectiveness now recommends a yoga therapy for people with back pain. And I'm not a cynic, I'm a yoga teacher, but I'm also an epidemiologist, and I guess I'm quite depressed about the prospect of this ever being taken forward, because the weight of evidence is never going to be the same as something you have for a hypertension drug, where you've got a massive sample size and lots of interest in investing in the research. I mean, it's great that there are some trials, but I guess I'd like to get the academics, Shekhar and Cherian's thought about who's going to fund that large-scale trial that's really needed. And going back to Shekhar's suggestion, there's yoga and there's yoga. So defining which aspects of yoga have a kind of causal effect on various outcomes is hard, and I don't really see who's pushing that agenda forward. So if you have any comments on that, and I guess it might relate to some of the mental health interventions. Hypertension might be different, but in mental health there are a lot of complex interventions, and the type of research that's needed, I think, is maybe similar to in some of your other areas.
Utilizing the opportunity of the Indian ambassador being here, my short answer will be India should fund it.
Yes, sure.
But my longer answer should be India should work with a variety of partners, including WHO, to make it possible for more evidence to be collected using the best of the scientific methods, and I think it's very much necessary. It can be done. Yes, we need to follow a very strict methodology to be able to collect the kind of evidence that is needed. But coming back to the question that was asked earlier, even if there is not a kind of compelling evidence, should people still practice it? And the answer is that the recommendation is based on what could be the potential benefit versus what could be the potential harm. And in this case, the potential harm is going to be rather small or none. So I think one should be a little more liberal in saying that there could possibly be some benefit and perhaps there is no harm. So one should go ahead and do that. And especially true for increasing the well-being and the quality of life and promoting health, including mental health, rather than to treat illnesses where evidence is much more needed. So that's my kind of top of the mind answer. But yes, certainly we do need to think more seriously about it. And as I was saying earlier, WHO's capacity is now better. So we should take this issue more seriously and do the kind of research that is needed. Thank you.
Yeah. The mental health department is better than our team has in terms of funding, so you are confident. But anyway, answer your question from my perspective is that we conducted a global survey several years ago. From the majority of member states responded, the top one challenge in the area of traditional complementary medicine is lack of research data. So we're talking about the evidence base, but the thing is that the challenge is that many either government or public fund, not so many invested to the research in this area. So that's one of the major reasons why not so many qualified research data coming up. So one of the 7 indicators for monitoring of WHO traditional medicine strategy is how much the funding invested by the governmental or public funds in this area. So we are talking about evidence, but no one to invest, to fund the research where the research results coming out. So I fully agree. I also trust President India will, of course, we will also call other countries or the academic research institutes to invest, including yoga and other traditional medicine research.
Yeah, if I may just come in, I think one thing that is troubling me always is that we start with the belief that anything that is written in a modern medicine textbook, so-called modern medicine, is the truth. And every other thing has to be tested through that lens. Whereas if you look at traditional and complementary medicine, the concept of disease is different. It is dis-ease, the person is not at ease. And that is very different in traditional medicine. And the concept of cure, concept of wellness is not just a few metabolic parameters. So we have to have a new way of looking at the world through the eyes of the complementary medicine or traditional medicine or the so-called modern medicine to see what is the disease concept here, what is the concept about the human body. Because, for example, in Ayurveda, you classify people into Vata, Pitta, Kapha. How can you randomize that? You cannot randomize because that person has that particular constitution according to Ayurveda. So I think that sort of a larger thinking is needed as to, it is like saying that Sanskrit music is not comparable to pop music. They are two different things actually. It doesn't have to be comparable to that. So I think within complementary medicine, we should have complementary medicine standards, complementary medicine outcomes, and research methodology to prove that. Thank you.
Thank you. My name is Vinayak Prasad, and I'm just speaking on Cherian's point of looking at complementarity. I go back to 2006. Ambassador, this is very important. 2006, I was in the Ministry of Health, and we were setting up, starting to work on setting up new All India Institutes of Medical Sciences. For those who don't know, Shekhar from AIIMS. These are institutions which now, there was only one, which is a center of excellence. It sets its own standards. It's not guided by the Medical Council of India, so it can set its own standards. And there's only one in Delhi for more than 40 years. So we were in the government trying to set up 6 more. And then another 7 are now coming. So there are like 14 or 15 of them. In the next couple of years, we'll have 15 of them functional. So for 6 of those institutions, Ambassador, we said we will look to create, amongst 1,000 beds, 30-bedded Ayush, which is the Ayurveda, Unani, and the yoga, all of that traditional, 30 beds. It's already there. We'll put a herbal garden. And it was quite a challenge for me to get the so-called modern colleagues, I'm myself from that stream, to get them to agree. But we said we are the ones who will set standards because there are no Medical Council of India standards. So it's very important. So at each of these institutions, Geetha, they are all functional. We have 30-bed Ayush in a 960-bedded modern medicine facility, herbal gardens. So what we have done in India, for example, create that opportunity. The question would be, back to Cherian's point, how do you make them, now we can physically host them together, how do you make them work together? Where are the guidelines to make that work happen? What are the kind of research methods which they could work upon from both ends of the spectrum? So that's a question to the entire panel. How do I get that done? How do I get then the Medical Council of India and other medical councils to think about it and put it as part of their programs for secondary, tertiary level complementarity? I wouldn't call it integration. Where are those opportunities?
Thank you. I think these are very thought-provoking comments. it is quite clear that in the last couple of years, the government of India has really started to focus on the science of yoga and the need for evidence. So that I did mention in my opening remarks that there is a particular program which has been run by the Department of Science and Technology that is in fact then funding research, and the call for research went out last year and a lot of proposals were received. Now obviously these will be various streams which should hopefully head in a particular direction. But my experience now, having served in a couple of countries and across continents, is that there's been an explosion in research on yoga across the globe. And there is mounting evidence, and this may be, the sample sizes are small, but quite clearly if there is a single center where you can aggregate this research, while it may not amount to proof of scientific evidence, but it is definitely pointing in a particular direction. And there may be certain areas that are more amenable to research and where there is a lot of work that is being done. And these could be the promising areas where you could farm out the research. It need not necessarily be India. Obviously, India has to take the lead. I mean, and when we talk about traditional medicine, I think what one is missing the point, and which was perhaps being made by the panelists, is that when we talk about traditional medicine, these are the longest standing human trials. For example, if you see that yoga is 5,000 years old, the fact that it has survived means that it has received the vote of confidence by the masses. Now, I think that is something that needs to be kind of recognized. But yes, a new paradigm is needed to kind of address these issues. But my sense is that a lot is happening as of now across the globe. Maybe the traditional, and complementary medicine unit could be the focal point where we do provide the platform where we discuss these issues, and where all the research which is taking place, then that can be encouraged to be, sent in the direction of the TCIM, where you aggregate it and then see where you could then prioritize what are the areas of research, and perhaps a global call goes out, where there is funding which is provided, of course also by the Indian government. So these are my initial thoughts. Thank you.
Thank you. But a response to your point. Two more activities in our team now is going on. One is that a technical guidance document of research, clinical study on traditional medicine, so which is focusing on methodology in the clinical study of traditional medicine. So the experts working on this, not only the traditional medicine practitioner experts, but also bring all the allopathic research, so the discussing together. So as you know that the traditional medicine primarily working on the chronic diseases, the quality of life, and so so it's perhaps the research methodology side we need to somehow select it. And also, for example, acupuncture. It's difficult to make double-blinded, so that kind of design. So we cannot use simply EBIM as a methodology. Also, that as you know, that traditional medicine is individualized approach. For example, both we are hypertension patients, but traditional medicine not only just hypertension and give the same formula to both of us. They will further make a diagnosis which pattern under the same disease, right? Maybe I am the right kidney or liver deficiency, he is not another one. And individualized either yoga approach or herbal medicine combination. So that kind of effectiveness, if your design of research not in that combination, but only diagnosing hypertension, and the same the diagnosis and same intervention, the effectiveness, the result will not be the same reflected the truth. This is only an example of our methodology. And also now, even the whole public health now research more, the trend is to the real world, right? The pragmatic approach. The same thing is for traditional medicine. Important is now the the tool side, right? Either AI or big data now is more and more technology side support traditional medicine, big data, or that so can generate the evidence from the real patients side. So some experts already millions of cases, medical records, and they use the big data technology and very quick generate where is the evidence. So experts are arguing now where is the strongest evidence is from the clinical side. It's not actually from the laboratory, right? Because this is particularly traditional medicine. All medicine is the same. Actually, is clinical efficacy effective. That's the eventual the criteria for evaluation. But anyway, that debate is there. Experts even study system medicine. So that it's a good point in integration traditional medicine with medicine. Second project we are now is initiating is working together with collaborating center or centers maybe so in 2 countries, working on the database of global qualified research and also platform. If the database really analyzed by the experts working on research methodology will be recommended to share with the health professionals and even consumers. And if it's strong enough, we'll recommend to WHO for the development of WHO clinical guidelines together with that guidelines methodology experts. So that's also ongoing.
In fact, we cannot take any more questions for the panel because we have run out of time. All the panelists are going to be available here, so the questions can be directed at them later at the end of the program. I would like to now go to the next session, which is the presentation on science of wellness from within by Dr. Suman Kolipara. Dr. Suman has a long, illustrious career in different segments of life and career. In fact, he is a veterinarian and also a technical geek and also a yoga expert. He is experienced and his expertise is in the Sukshma meditation program. And he is on a mission actually on transforming the reach of wellness in the society through the approach of educate, experience and enlighten. I request Dr. Suman to take the floor.
Thank you very much for the warm introduction, Dr. Geetha. I'm truly humbled and honored to be in the presence of such an esteemed gathering, which is filled with eminent scientists, noble doctors, heartful healers, visionaries and leaders at WHO. In fact, I would like to start the presentation with a small piece of music so that we kind of lighten up. We have been having some serious discussions here. So you will see that my presentation will kind of take a different pace. So here it is. So with that introduction with music, in fact, 12 years back, I went to Master Sunita is right here to learn about yoga and meditation. Before that, I was doing some meditation, but I was not formally into it. And when I went to her, I asked a lot of questions about yoga meditation, and I wanted to start practicing. And the first thing she wanted me to do was smile like this. And I was not sure what she was trying to teach me with that simple, subtle smile. You don't have to close your eyes, but just simple smile. And in my 12 years of journey, I have realized the power of that subtle, simple smile on the lips. The moment you bring that smile onto your lips, dears, you will drop into this present moment. You will drop into the presence of this precious resource. And instantly your body starts to relax, your mind starts to relax, and there is a change in physiology and psychology. So I would encourage you all to please bring those smiles onto your face. I see so many serious faces. This is all about relaxation. I realized that yoga is to be smiling no matter what, to be in the present, to become one with you, to become one with everyone. And that can happen only when we can open our hearts, open our smiles. So please, everyone, bring those smiles so that we'll make this presentation lighter, relaxing, and end this with, of course, Master Sunita's talk and demonstration of meditation so that you can walk out from this space with experience of the true essence of yoga. So my journey within started, as I said, 12 years back. I went to Master Sunita. I wanted to learn. And then when I asked her a lot of questions about yoga, she said, Suman, yoga is a journey within. Yes, of course, there are asanas, there are breathing exercises, lots of these techniques. But the true essence is to realize that you are nothing. Because when you close your eyes and look within, what do you see? Nothing. Literally nothing. But that nothing is not nothing. Master Sunita said, Suman, that nothing is the pure vibration of energy that is there in each one of us. Even though there is this physical body outward that we see, there is that subtle vibration of energy, which she calls it Sukshma. Sukshma is a word from ancient Indian language, Sanskrit. It translates to micro, subtle. And she said, once you experience that subtlest of the subtle pure vibration of energy, that is the source of healing. That is the source of transforming illness to wellness. And then I started my first session with her. And after I came out of that first session of Sukshma, I was a completely different person. There was a shift in my psychology, shift in my physiology. I was experiencing this pure state of bliss. There was glow in my face, twinkle in my eyes, soothing, subtle joy in my heart. And of course, coming from a background of medical science, I was quite skeptical. I was rational. I was questioning everything. So I went back to her 4 times. And then within 4 sessions, I used to have irritable bowel syndrome. And I was going through a lot of emotional stress at that time. Everything kind of disappeared. It may sound mystical, but you know, I have continued my journey for the last 12 years. And I've seen hundreds of people who have come to practice this subtle form of yoga and meditation called Sukshma, heal from simple stress to very complex illnesses. We're talking about psychiatric illnesses like anxiety, depression, panic attacks, OCDs, autoimmune disorders like Crohn's disease, colitis, rheumatoid arthritis, and of course NCDs like hypertension and diabetes. All cured, and people got off medication within 6 to 8 sessions. All that they had to do was simply go within. And I realized that yoga is to take care of this precious resource, this beautiful miracle called human being that starts as a single cell zygote in the mother's womb and becomes this complex organism. But somewhere in the process, we turn that human miracle into human misery. All because of self-inflicted pain and self-destructive attitudes, dears. And of course, we call that on a day-to-day basis stress. You talk to anyone, they say, oh, I'm so stressed, I'm so busy. Stress because of finances, stress because of career, stress because of relationships, stress everywhere. In fact, I tried to understand the stress from the scientific perspective. And I came across this wonderful research done by Dr. Robert Sapolsky. It's a book that was published called Why Zebras Don't Get Ulcers. Well, you might be wondering why we are talking about zebras in the presence of humans. You know, my background is a veterinarian. I'm really passionate about animals. In fact, my friends tell me today, Suman, you used to tame animals in the past, now you're taming the inner animals in the human beings. So true it is. So when zebras under threat, so he spent about, Dr. Robert Sapolsky spent about 25 years in African savannas. He studied zebras, baboons, and human beings, and he wanted to understand stress. When zebra is under threat by a lion, obviously there is stress in it. There is stress mechanism that kicks off, sympathetic nervous system is triggered, heart rate increases, blood pressure increases, lungs expand to take more oxygen, blood glucose levels increase, release of adrenaline, epinephrine, cortisol. All of these happen instantly. Now let's say the zebra survives the lion. What does it do? It's just going to go back and relax. It's not going to sit there and think about the previous lion. Oh my God, why did this lion do this to me? It's not going to sit there and worry about the next lion. Zebra lives in the present moment. Whereas we humans can trigger that same stress response, the same fight or flight response with the thought. That's the power of human thought, dears. You can be sitting in this chair and worry about stuff constantly, night after night, day after day, and you can start to abuse this evolutionary response called stress and fight or flight system, which eventually leads to most of the chronic illnesses that we see in today's world. And of course, when you look at it, what is the root cause of stress? Of course, there are lots of external circumstances, but if you really go deep and understand, the root cause of stress is that untrained mind. Untrained wandering mind, the minds which keep jumping like monkey, called the monkey mind, from thought to thought, collecting all the garbage out there. What did he say? What did she say? Why did he do this? Why did she do that? And eventually that garbage starts to stink. Where? Right within. And we become an intoxicated elephant. Self-destruction and destruction of everything in our path. That's the story of most of the lives in the world today. In fact, we don't have to blame ourselves. We can blame the evolution for it. Because the brain that we have is in fact made up of 3 brains. Because we are a product of evolution. If you look at the brain that's there, right there, in the orange color is a reptilian brain. We have the footprint of that in us, which has basic survival of the fittest instincts, dominance, aggression, just feeding, no emotions. And then the central portion of the brain, the green color, is the limbic brain, which is responsible for emotions. Amygdala and hippocampus is located right here. Unfortunately, we live most of our life in that emotional limbic system. We get triggered with these emotions and we get entangled in these emotions. And the top blue portion is the prefrontal cortex. That's the new human brain. But of course, we're all evolving, so we haven't mastered to use that prefrontal cortex. We live in that emotional part of the brain, and we entangle that pure I which comes into this world as innocent, intuitive child who already has the intelligence to do amazing things. But over a period of time, we go through this emotional roller coaster ride of happiness, sadness, excitement, depression, and we get clouded. And we forget that subtle I, which is our true nature. So the root cause of most of the mental illness and NCDs, as most of you know, is the lifestyle and the behavior. It is within our own hands, within our own reach. So what is the solution, dears? I know for most of us the solution is take a quick vacation to Hawaii, Bahamas, right? All that we get those from vacations is skin level relaxation, dears. I'm not saying vacations aren't bad, it's important. But what we need is source level relaxation, and that source is within you, and that is the true essence of yoga, to take you to the source within, to that pure vibration of energy which can do wonders. And so the work is on the self, not on others. And that is where Sukshma comes into the picture. So what Master Sunita has done is taken this extract of all the ancient wisdom of yoga and meditation and tailor-made this program which is perfect for the modern hectic lifestyle. We don't have time for 1 hour asana, 1 hour meditation. How can you recharge and rejuvenate? In 10 minutes, in 5 minutes. How can you do that? And that is the essence of Sukshma. And we have seen phenomenal results in the past 12 years of my journey with her. And of course, she has been doing this journey for about 40 years, 4 decades, and healed simple to complex illnesses through these simple, subtle practices. So what exactly is Sukshma? Of course, it starts with the self. No matter what problem you go to Sunita, she says, Suman, start with the self. And Sukshma's foundation is self-compassion and self-love. We are all interested in getting love from others and giving love to others. But we never take time, dears, to love this precious resource. Self-compassion, showing compassion to yourself. And of course, smile is the foundation. I don't see anyone smiling. Everyone's lost. Please bring those smiles, dears. Thank you. Thank you. Keep those smiles, because it will relax you, it will relax me. And there are subtle physical exercises. Yes, there is yoga, the full practice of asanas. But she says that is important. But first start with simple things. Then you can expand into the traditional yoga, asanas and all of that. And there is breathing, simple breathing techniques. And of course, meditation to relax, rejuvenate, and recharge. And most importantly, the essence of Sukshma is the pure empathy and the pure vibrations and compassion, which we have forgotten as humanity. And Sukshma, there is a lot of science behind it. Self-compassion is not just a mumbo-jumbo abstract concept. There is a lot of scientific research, and Dr. Kristen F. is one of the pioneers in this research. And she says that you want to be more healthy and happy because you care about yourself. Master Sunita calls this genuine selfishness, dears. Be selfish in the first 1 hour of the day to take care of your body, your mind. It is yours, given to you. And once you start to honor and accept your humaneness, then we automatically can accept others easily. And that acceptance is enlightenment. That acceptance is yoga. And of course, smile. I'm not just again saying it for mumbo jumbo. There is solid scientific research. Charles Darwin did this research on facial feedback in the 1800s. And this is Dr. Emma Seppala. She's the director at Stanford Center for Compassion. She says, bringing a smile, even if it is fake, can do wonders. So even if you don't like me, please bring that smile. Fake it for a few minutes. And you will start to see the change in you, dears. And breathing, of course. It's a natural state of our existence, but yet we pay least attention to it, dears. We ignore the breath, which is our life force, without which we don't even exist. Solid scientific research. This is from Stanford University. Simple breathing techniques can decrease anxiety, depression, increases happiness and optimism, improves sleep, great insomnia pill. You don't need that glass of wine or that sleeping pill before you go to bed. Simple breathing practices can just start that sleep cycle. Regulates emotions and addictions. And of course, simple breathing techniques can trigger parasympathetic nervous system, which is exactly opposite to the sympathetic. Parasympathetic is your rest and digest, relaxation response. And you can trigger that in 2 minutes. Simple deep breathing, boom. All your heart rate, blood pressure, blood glucose levels come to normal. This is a state called homeostasis in medical science. Perfect state of equilibrium. We have the potential to heal ourselves. And of course, I would like to quickly give you a tour of some neuroscience of yoga and meditation. And one of the first person who comes into my mind is Dr. Richard Davidson, who has spent the past 2 decades in researching. He's a Harvard neuroscientist, has spent a lot of time with monks and people who practice meditation and done innumerable studies, published lots of papers, research papers. And he says in the next 20 years, people will regard mental exercise same as a physical exercise. Yes, we are all trying to get fit physically, which is important. But with the information age that we are living in, dears, with information bombarding us, of course, with these beautiful devices, we wake up with these, we sleep with these. Every second we are living with this. And I see teenagers going through trauma. I work with teenagers in schools, outside in the communities. ADHD, anxiety, depression, suicides. We have a perfect recipe for a human disaster, a silent killer in the working spheres. Unless as a culture we start to make those changes at the family level, at individual level, we are set for a disaster. And of course, when you start meditating, there is something called neuroplasticity. There is a lot of scientific research. It's a new area of research in the past decade or so. What it says is basically you can reshape and restructure your brain. Neurons that fire together, wire together. Every time there is a thought, there is an electrical impulse that travels in your brain, and it brings 2 neurons together. And as you keep repeating the same thought, the neurons come tighter and tighter and tighter, and that becomes permanent. And they have seen that when people go through chronic stress, there is changes in the parts of the brain called amygdala. They have seen thickening of amygdala. But the beauty now is that with practices like yoga and meditation, you can reverse that. They've seen shrinkage of amygdala, which we're going to take a look in a second. So here is one of the studies that at Harvard Medical School, Massachusetts General Hospital, they found after meditation and mindfulness practices, there is increase in the gray matter density in the brain, which is responsible for self-regulation, emotional regulation, memory process and learning. This is real, dears. It's not hypothetical anymore. This is the research I was talking about, done at University of Pittsburgh. Meditation practices actually decrease the gray matter volume in amygdala. And it explains why mindful and meditative individuals have reduced stress reactivity. We can take charge of our lives. Another beautiful study done at the Imperial College of Medicine in London. They found in meditation practices increased theta wave activity. If you look at the graph there, the topmost, the beta brain waves, the red waves, the red graph on the top, is when you get anxious, irritable, frustrated, irritated. And you can shift that with simple meditation, and you can start to get into alpha brainwaves and theta brainwaves, and of course delta, which is where the healing, rejuvenation, creativity, inspiration, all these phenomenal things happen. And they have found that there was 65% increase in dopamine release. I'm sure you all know what is dopamine. You have that piece of chocolate cake, you get that kick, you want to have one more, right? That's because dopamine is released in your brain. Now with meditation, you can get that same kick. So this has been very important, especially in people with addictions, because now you get that bliss and that euphoria from the practices of meditation. And another very interesting study is this nerve growth factor that is there in saliva. 12 years back when I went to meditation with Master Sunita, she said, Suman, when you meditate and start doing yoga, you will have a lot of saliva coming through. Swallow it, it's good for your brain. At that time I thought, oh, whatever, some mumbo-jumbo stuff. But recently I came across this phenomenal research where they are showing that yoga and deep meditation stimulates salivation, which is filled with nerve growth factors which are responsible for maintenance, proliferation and survival of neurons. This is reality, dears. And of course, vagal nerve tone. Vagus nerve is the longest nerve that starts right here at the cranium and then goes and intervenes pretty much entire organs in your system. And it regulates your heart rate, breathing, respiration and digestion. When you have that perfect vagal tone, you have the ability to handle stress and shift to relaxation mode. And what they found is that mechanical and electrical activity in the vagus, in the asanas, actually regulates your vagus nerve stimulation. So with that information, with that realization and experiences that I have seen in the past 12 years back, I have co-founded this non-profit organization called Peace Tree, with a simple goal to educate, experience, enlighten. We conduct these workshops and programs throughout the community at grassroots level, in libraries, community centers, schools, hospitals, you name it. And we have a simple goal of wellness, fullness, and oneness. Wellness, to create that perfect health. Fullness, to experience that joy and bliss and happiness. And oneness, to create that harmony with yourself and harmony with people around you. And we do this with a three-step process. Our presentations usually have, the first 30 minutes is about educating about the mind and the body and the science behind it. I want my mother, who is a layman, who doesn't understand the medical technology, medical terminology, to be able to relate to this. This is where we are making a difference in bringing awareness. And we don't stop there. In our sessions, we do a 30 to 40-minute practice so that people, when they walk in, they can see that shift in that experience. Information to transformation. Only when we have the transformation, there is an inspiration from within for them to go home and start to practice. I get these innumerable emails from people who come back to us and say, wow, this changed our life. Now we are able to sleep well. We are able to have less anxiety. And then, of course, when I say enlighten, I'm not talking about one becoming a yogi or a monk and running into a cave and sitting there rest of their life. I'm talking about enlightening about yourself, knowing your peak potential, in fact, which aligns with the definition of mental health by WHO. Mental health is defined as a state of well-being where every individual realizes his own potential and cope with the stress and can work productively and fruitfully and able to make contribution to his or her own community. And we are able to do that through this work of our non-profit in various parts of the world, very specifically in, of course, Canada, where we live. And we have conducted not quantitative studies or controlled studies, but qualitative narratives we have from these different places. This is a place where we have done for addiction. And I want to share with you quickly letters written by these people right after their first experience of Sukshma. And this is coming from people who are going through severe addictions. And they are able to relax and shift their experience and able to take this with them. And another study that we have done at Psychiatric Inpatient Unit at Vancouver General Hospital. Again, couple of letters will give you a perspective of what we can do with these simple interventions. It doesn't have to be big, complex. And we have done a project at the Surrey Correction Center, the prison project, where Master Sunitha spent time with the inmates who are going through, of course, severe psychological and physiological turmoil. And just to show you the transformation within a couple of sessions from these people. I had to hide some confidential information there. But you see, the person in a prison says, I feel glowing, happy, mellow, excited, rested, aware, and at peace. Dears, if they can do it, we can all do it. But the problem is, we live in this inner prison. We construct these huge walls of conditioning with our minds. We pollute our minds with these vices. We create a prison, inner prison. We pollute our senses and start polluting this mind and create these subconscious clusters crystallizing. In Sukshma, we have found that we can break those walls of conditioning. All that it needed was to shift that mind. Mind is like a coin which has two sides to it. One is an entangled mind. The other one is a witnessing mind. The moment we help these people to practice these meditations, where they were able to witness their own thoughts, witness their experiences, that was a game changer. All that they had to do was take a step back and observe themselves, observe this preciousness. So, my dears, I think we have a good solution if we can start to embrace wellness from within, which is the whole essence of yoga and meditation, to cure and prevent mental illness and NCDs. And Sukshma is to take that time every day to care for the self, smiling and empowering yourself, dears. You can use the smile wherever you are, listening to me while you're driving in your car, when you're cooking, when you're taking bath. Use that smile. It's the simplest technique that you can use to make yourself healthy. And many of my friends, of course, who are skeptics, they say, Suman, this is all BS. And I say, yes, it's BS, not the other BS. All it takes is to simply breathe and smile. And they're right here, breathe and smile. And I see this as a new prescription, hopefully, going forward, coming from our doctors. When you go with a problem, hopefully that will be a reality soon. And all that it takes is to, in fact, I was walking through the doors of WHO today and saw this poster outside. We were able to eliminate smallpox from this earth. The smallpox that is caused by virus, an external agent. And it took a lot of awareness campaigning to remotest parts of the globe. What I feel is if we can do the same, but the problem is, it's not the virus from outside. It's the vices of the mind inside. It's actually a lot more easier because we have more control on individuals. So if we can build a model of educate, experience and enlighten and take this in a massive level to communities, we can actually prevent these mental illnesses. Education should begin at schools and families. And all it takes is to take the brain to gym. Brain has been always at the forefront of our evolution. Instead of living in the reptilian and the limbic system, we need to scale up to the prefrontal cortex. And as the famous Dr. Jonas Salk, who discovered the polio vaccine, says, evolution favors the survival of the wisest. We need to shift from the survival of the fittest mode to survival of the wisest mode as a humanity. And that is where bridging ancient wisdom and modern medicine is the need of the hour. So this will take us to the next part of the presentation, where we have an ancient sage for a Silicon age who can help us bridge that ancient wisdom and modern medicine. Thank you very much.
Thank you, Dr. Suman. It is really wonderful. In fact, now I would like to introduce Master Sunitha. If I know right, and if I had, as I have been informed, she had a very, very serious illness at the age of 9, and then was really debilitating kind of an illness, where after which her father initiated her into yoga and meditation, and then she understood the power of healing of yoga, and then came out of the situation with yoga, and she was able to train herself and start helping others to heal themselves by the age of 19. That's what. And I'm really glad that we have her here today and to take all of us through a session of yoga, which is her specialty of Sukshma meditation. And I'm sure that all of you will enjoy that.
Namaste. Sleepy? No? Now you understood what is Sukshma? Is it okay, the mind? Can I go there and then? Hello? No, it is not. Can I go there? I can. Hello.
It's like the Sukshma energy is vibrating.
Energy is interacting with energy. I am receiving your energy and you are receiving this energy. Being aware with awareness. Being aware with awareness. Maybe tired, I think, Mike, since morning. Shall we give rest then? It's okay now? Okay. Are you doing BS? The homework he gave, Dr. Suman? Be, breathe and smile. Where is that? Just remember, tip of your nose under that. That's all. How near? Are you smiling, all of you? Please. That will bring that energy. That energy will make that vibration. So, sthulam, sukshmam, sukshmataram, sukshmatamam api, sparsha, sabhashana, darshana, and sankalpa. As a kid, I learned this scripture from my father. He said that sthula means gross. Sukshma means subtle. Sukshmataram means subtlest. Sukshmatamam api, subtler. So, first one is sparsha, touching. Sabhashana, speaking. Interacting with energy. Darshana,
I came to see you all. Darshan means I saw you. Secret heroes. They don't want to tell their names. How beautiful that is. Sankalpa. Last one is Sankalpa. Just I am thinking that I want to give energy to you all. Finish. You don't have to touch me or talk to me or look at me. Nothing. That is resolution. So, shall we take one promise before starting meditation? Shall we? Okay. Shall we get up or?
Yeah, everyone, can you please stand up?
Take a deep breath. Take a deep breath. Open and hug yourself, please. Hug yourself and swing nicely. Repeat after me. All of you. Ah ha 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 ha. Ah ha 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 ha. Ah ha. Take your names. My name is Sunita. Amma, I love you. Can you take all of your names?
Suman, I love you.
All of you. Nicely. With affection, with love. I love you.
I love you.
I respect you.
I respect you.
This is my promise to you.
This is my promise to you.
You are my first priority.
You are my first priority.
వచ్చింది దాంట్లో చూపించడానికి ఇక్కడ ట్రై చేస్తుంటే అక్కడ వచ్చి ట్రై చేస్తుంటే అక్కడ వచ్చి
Being in present with what? BS. Being you. You. Maybe you are a mother, you are a father, you are an ambassador. You are so. First you take care. First you take care. You can do so much, I am telling you. Promise. Right? So many mothers said that, How can you say that? First priority is our children, husband, grandchildren. But by the time, what they said that? Diabetes, this, that. Thanks to Dr. Cherian, he reminded me, Madhumeha Nivaranaha Makshendrasana. It's a great saints. Centuries back, they found that after so much penance, they found the postures. What is the Sukshma then? Sukshma is integrative between the bhakti, devotion. Devotion means who will give guidance? Only God will protect. Who? Devotee. Because they don't do anything. They close their eyes. Somebody has to take care. Who is taking care of them? God is protecting them. Next, jnana, the knowledge. Without any egos, God is instructing them. Continuously instruct, but they have to be open. I'm a dentist. Enough. No, that is your profession. Knowing about yourself, myself to higher self, absolute truth. Next one is karma, action. Everyone wants that to act. If you are an ambassador, too many, but morning they are getting up, they are doing and hitting the word. Amazing. Doctors, whoever, first take care of yourself. That is, who is taking care of karma? God's guidance is coming. So, first one is God's protection. For devotees, protection will start. Guidance and instruction. Integrity between these four, three, meditation started. If I queued at the age of 10, And since at the age of 19, I started healing and taking care of in Africa, 14 years in India, and 20 years in North America. This is the first year. You understood what is my microcosmic energy. We all have pure energy in and out. But covered by who? Raga, Dvesha, Virahita. Raga means attachments. You are my blood. What is happening? What you are giving? What genes you are giving to them? Cancer? Diabetes? Genes is there. No. If you are really, you love your family, just what he said that, Cherian said that, peaceful death and bedridden death. We all go, right? We need any passport? Do we need any passport? I don't know. Mr. Ambassador, do we need any passport? No. So, we'll go. So, one question now. Yes, we all want peaceful death anyways. What is the nature of the body? You can sit now. Relax now. Long time, right? You can sit now. What is the nature of the body? Any of you, please, cooperate with me. What is the nature of the body? Our time will finish. Huh? Body made out of 5 elements. Okay. Nature of the body. What? Nature of the body. She said that, body made out of 5 elements. How true? Exactly. Okay. What is the nature of the body? Any one of you, please? Nature of the body. Nature of the body. No one can argue with that. Can I tell? You all know, but you don't want shy, I think so. Nature of... Oh, who? Ah.
Go ahead.
Dying? Yeah.
Aging.
Yes, you are correct. Yeah. First one. Birth, growing, decay, and death. That is the nature of the body. But how many things are there in the body? 7 attributes are there. Rasam, Raktam, Mamsam, the flesh, plasma, blood, bones, and bone marrow, and reproductive tissues. Right? Okay. We leave there. Vata, Pitta, Kapha. Cherian said that, Vata, Pitta, Kapha. 5 elements. Vata is what? The space and air. Remember this. Space and air. Pitta means fire and water. And Kapha means water and earth. You remember that? See? Right? There is no confusion now. Okay. Now next we'll go to imbalance of these 5 elements. Diseases will start. 72% water, 12% earth, 6% fire, 4% air, and rest is space. It is all there. It is all in universe. We have to match. But are we drinking water? How much water one should drink? Any idea? 3 to 4 liters. Any of you, ma? 3 to 4 liters. Can I tell? Huh? 2 liters. 3, 2. Okay. Don't worry about 2 or 3 or 1 or anything. Take your height, your weight. Every 10 kilos, 10 kgs, that means 110 pounds, should drink 350 to 400 ml. Then you can multiply. If you are 60, so and so. You remember now? You drink the water, no? That also, before 9 o'clock, you have to drink half of the water. If you want 4 liters, 2 liters has to finish before 9. Do you understand? If you get up 4:30, you can finish by 6:30 all water. But if you get up 9 o'clock, Not you, outside of people. You are very good at, that's why you stayed there, So many people went, but you stayed means you are drinking water. Right? Now you understood, right? 10 kg has to drink 350 to 450 ml. And you can multiply and every day before 9 o'clock. Why 9 o'clock? Any idea? Please. What is it? How much time I have? It's okay? Thank you. Where are you?
Nature of body.
No. Water. Yeah. Why before 9 we have to finish so much water? Huh? Detox. What is your name, dear? Anuradha, thank you very much. Detox. And anything else? She said detox. Anything else? To hydrate the body. Yes. Yes. Let us take that detox. 75% water will go to all what I said, 7 attributes, blood and tissues, this will go. 25% will go to urine. After 9 o'clock water, reverse. 75% is going to urine, blood and this we are not getting. So how many of you drink from tomorrow? Quick results. In this birth only. And next birth I will come, this time I will drink only Coca-Cola, coffee, teas. You used to drink Dr. Suman. Oh, I will listen everything, but don't put rule. First of all, drug addicts, alcoholics, I don't put rule. You think so, coffee, tea, I will put rules? It will happen. After the meditations, it will happen. So many people are alcoholics, drug addicts, since 40 years. Now, enough body. Let us come to mind. What is the nature of the mind? If you take this much time, meditation will stop, they will announce, you have to go. That is up to you.
She said peace.
Huh?
She said peace.
Peace? Okay. Did I ask no? Who said that no? No negative. Yes, Amma, peace. Next. I will come back to you. Who said that peace?
I think she said.
Okay, thank you. And next.
She's saying. See, Amma. And then she's saying.
Please.
Nature of the mind is wandering.
Wandering, yes. Yes. Yeah, correct. Thoughts flow. But ancient wisdom is saying, because he said that ancient yogi, I have to bring that ancient wisdom. Ancient wisdom is saying, mind is purified by friendship, compassion, kindness, equally towards happy, unhappy, kind and unkind human beings. When I went to inmates, hard murders, 5 murders. They will go all with security. I didn't go with security. I didn't put even phone. I never use cell phone anyways. Okay? They said that, how can it will be? We are not good people. No. The situation, that bad toxic emotion happened that whatever. That's why you did. That is not you. No identity. That's where after meditation, 1 year I did for inmates, they said that, yes, you are correct. Why? When you meditate, what will happen? Body, mind relaxes and rest. I am not this body, I am not this mind. Right? Next, third part, who is that? Who is this I is observing the stillness, peace, harmony. Who is this I? Second one is, what is the nature of this I? Who is observing this? Because body, mind, nothing. We are thinking mind, body, but somebody is, who is that? Where is this I? I want to catch this I. Where is that? Oh, I can't see. Now at least I could say that, mind is here. Where is this I? Anyone of you? Where is this I? Consciousness. unlimited energy, but we are leaving that. It's okay. Thank you, Amma. Thank you. So now you understood the conscious, because in this meditation, sukshma, subtle way meditation, you dive into that depth. The mountain, the water will come from the mountains with force. Then river will happen, river with flow. Flow, flow. River doesn't flow, right? Doesn't stuck anywhere. Until reaches ocean. Same way we are also. Now we understood the nature of the mind is friendship. Remember that. Be friendly with you at least. I don't like my nose. I don't like my skin. No. Don't do that. I love myself. Just now you gave promise to yourself. I love myself. Remember that promise? Front of Sunita you did. Respect yourself, no matter. God gave that beauty also, God gave that whatever also God gave. Right? Now, let us leave the mind. Mind, I have to say anything? Because I am, third entity is soul. What is the nature of the soul? Not you consciousness. let them. Okay. What is? Imperishable. Okay. Peace. Yes. Next. Imperishable, peace. Any of you? Not you? Light. Light. Beautiful. Please.
Love. Love.
Love. Yes. Yes. Pure love. Yeah.
Life force.
Life force. Source of energy. You are coming very near now. Super consciousness. Okay.
State of bliss.
State of bliss. Okay, she is coming very near now. Sat Chit Ananda. Sat Chit Ananda. Not I want bliss. Not I want love. Not I want peace. I am peace. Not I am awake. I am that. I am that. There, what will happen? Prajnanam Brahma. First Veda said, Prajnanam Brahma. What is that Prajnana? Knowing about myself, not with others. Knowing myself. Who is this Sunita? How many good points and bad points are there? We are all human, right? We'll make mistakes. But the mistake should be not repeated. Learning process. Never worry if at all we make mistakes. Never worry. But don't repeat too many times. 2-3 times is okay. Is it okay? That is up to you. But I didn't make this mistake again. This is second mistake. This is third mistake. Let it go. But don't stuck here only. Same mistake, I didn't learn anything. Okay, next time I don't do. Same mistake, don't do that. This is my last mistake. This type of mistake is last. Yes, sweethearts? This mistake. So, now, nature of the soul is eternal. Nainam chindanti shastrani, nainam dahati pavakah, na jainam. Bhagavad Gita is saying that 5 elements can't burn this soul. No one. Every time we come, first to people, before 7th month, baby inside, very aware what she did now. But after 7th month, once come out, mama, dada, identity, attachment. But when you do real meditation, at the age of 2 years, This Sunita understood she is no different. Who found? My father is a noble man, meditator, yogic person, Ayurveda. I brought up in Ayurveda family. That's what I'm saying. I'm integrating these three. But only three we need: body, mind and soul. Shall we start meditation now? Is it okay? Yeah. Did you understand, no? Everything? Nature of the body and don't forget, please. Okay? Relax. Relax. Now, if you want just to open up your, this is unconditional love for, see? 3 times. Now lateral. Other side. Now put your positive finger. This is positive. Anuradha is so sweet. that is not correct. No. Because this is negative, this is positive. Both will mix that. Positive energy will start. Energy will start negative and positive. Same like electricity. Right? Okay. Now put your positive finger inside. Go and grab the fruit. Scrunch your face. I hate this. Smile, yes. I love that. Scrunch again. Still anger is not going. You can do that. Then anger will go. You don't you don't express front of anybody, no? You won't be in problem. Go to the mirror, scrunch your face. Still I am angry. Until you feel the, beautiful laughter. Amazing, right? How simple, huh? Okay. Next we open this one. Now we open the fire energy. Fire energies, because no time, otherwise I can go each and every element where we are becoming victim. Fire elements are too much eating, that also toxic fire. Too much eating, everything. This is good, that is good, until we become weak. Second one is no hunger. How many items you are putting? Oh, no, it's okay. It's okay. That also not. That is called Mandagni. Third one is Shokagni. Every time crying. Even good things also crying. Self-victim mode. Self-inflicted pain. Fourth one is Kamagni. Kama, Krodha, Moha, Lobha, Mad, Maksharya and Bhaya. Out of 10, more than 5 is, we become victim. As Dr. Suman said. We become victim. That's why make sure, we all go through all this, but make sure that will be just. And act. Whenever you get angry or jealousy, just act. Act. Don't attach. Act. If I get angry on Dr. Suman, I will shout, but inside, it's okay. He learned something. That's what you have to do. Parents, that is very important. Even children, they will make mistakes. But be there. Otherwise, they will go to others for solution. Never give chance to others. Let the baby comes to you. Doesn't matter. 15, 20, 30, 40, 50. I'm a 10th child. My parents are old. I used to think, God, please don't take them. As a 2 years girl, I used to cry. Because grandchildren used to say, Grandpa, one day when you sleep, then I stopped sleeping. Self-inflicted pain. At the 10th birthday, deathbed. Because no eating properly. But now nothing happened. Okay. Now, where are we?
Fire energy.
Fire energy. That is Kama. Last one is Badabagni. Destiny. God will think, you know what? You are not cleaning anything. I am giving chances. Then I will do something. Because awareness will go now. When we are driving also, no awareness, accident. When we are doing something will happen. Why it is happening for me only? Finish. You are not cleaning them. That will happen in Sukshma meditation. Okay? Only one element I took today. And next one is just to put your positive finger, willpower. 1, 2, 3, 4, 5. Other side, 1, 2, 3, 4, 5. Chop, 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 chop. Liberate now. Liberation, true liberation. Now, one more breath work we can do. Put up, up. Repeat after me. Once more, take deep breath. Little upper also you can take. Once more you want to do this?
Yes.
Once more? Okay. You do now. I don't do. I will watch you. Already you became so peaceful. I am in anger now. Like a what is that? B. B. See, when B gets anger, when sweet is there. We have to kill that. Otherwise, we have to run away from that. We don't need that killing or anything. You be alert. You be awake. Be in present. Whatever you are doing. Cooking, just be there. Actually, when lectures are going on, I don't be here actually. But today they said that I have to sit in this place. If I will be there, I will go outside and I will take care of. Not that I shouldn't listen. Because I forget, because of my empathy, I'll become Dr. Suman, I'll become Dr. Rajiv, Chander, like that. Shalini, Dr. Shalini. That's where I'll be very careful. I never go out anyways, but I am giving so much energy to everyone. That's what I'm thinking. If you think also, that is great. Okay? Now, next step. North, south. Okay. Remember, north, south, east, west. Okay? Follow me. 3 times and nostril. Down. Your right. Inside smile. Now close your nostrils. Vata, Pitta, Kapha. 1. Vata, Pitta. Control exhalation. Beautiful. Once more. Other side, please. Close with your ring finger. One more. All the impurities are eliminating. Now close your right nostril. Inhale through your left. Close both nostrils. Open other side. Same thing. Now inhale through right. Relax now. Use your right hand, thumb on your right, ring finger on your left. Don't change. If you want to put here also you can put, or fold also you can do. Yes, that is correct. Don't use your left, that's all. Okay? Enough now. Shall we start meditation? You are ready? You are feeling peaceful, very peaceful? Nice smiles are coming. The sound has to come. Why sound is not coming? Sweet, sweet sound will come, audible sound. Did you see that? You can hear? All of you. All of you. Okay. See, you want to stop, you don't want to stop now. Whichever country I'm going, everyone they will say, how can Sunita? We are worrying like anything. You want us to smile? You are forcing. Night email will come. Oh my God, we are smiling, Sunita. What is happening here? Did you see? They practiced. Unknowingly they practice. Virus. Smile is virus. Anu to this to that to this. Energy will start, vibration will start. One more we'll do. So, hum. So means, God, you are within me, I am with you. My every inhalation you are entering in me, every exhalation I am entering to you. Okay. Pull the chin. Double chin also won't come. So, hum. In, out, 1:1. Down. Now alternate same thing. Other side. Last one is munching the air balls. Ice cream. Munching again. 5 times you can repeat. The exhalation should come through your nostrils. Ice cream, you are eating ice cream, munching. 2 more times, please. Now just rub, open, tap, 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 tap. I'm there for you. I gave promise to you, right? I'm there for you. Just tap. Now, close your eyes now. Close your eyes. Drop your body. Tailbone in. Chest up. Drop your shoulders. Relax, sweethearts. Relax. Everything will be all right. All is well. Remember always that word. Pain and pleasure, they are all our experience. That experience is turning to knowledge. Knowledge to wisdom. No, one can say shut up to wisdom, remember that. No, they don't say anything, they don't allow us. No. If you practice this one, accept everything. If you want to enlighten what? Accept, good or bad, doesn't matter. Everything is coming to experience, knowledge. Wisdom. Relax, relax, relax until you feel that your heart loved up. Your blood flow. Subtlest subtle. Amma's voice is coming, Sunita's voice is, you are listening. Your breath also. Observe your breath, witness your breath. Don't open your doors to otherwise things. Drop your shoulders. Relaxing your whole body. Focus on your toes. Big toe is the akash, the sky. Feel that the grey clouds are disappearing. Transparent white clouds are moving. I like only sunrise. I like only sunset. No, accept. Enjoy that sunrise. Enjoy that sunset too. When night will come, stars, galaxies, cosmos, moon. Feel that sun is entering inside you. Your face is glowing with aura, self-love, self-respect, self-repair,
self-healing, self-realization, self-compassion. Shariram madhyam kalu dharma sadhana. Charity starts through your body, with your body. Mana prashamana upayaha yoga ityabhidiyate. Only yoga. Yoga is not only postures. Yoga is inner being and external being. Action and knowledge. Union between these two. Relax. Bring that smiles now. Just corner of your mouth is a little bit. That's all. This is called Mandasmita, short meditation. Mandasmita means mild smile for myself, not for any others at the moment. Your toes are relaxed, knees relaxed, whole body ascending towards. Relax, relax. Rejuvenate under the divine shower. Cleaning, cleaning, cleaning. Purifying, purifying, purifying. Silencing, silencing, silencing. All the toxins are running away from you all. Divine energy is filling in each and every cell. 75 trillions of body cells are filling with energy. That's where mental illness, emotional imbalance, physical problems will heal faster within 8 sessions. Relax, relax. Now your body, mind, relaxing and resting. Third entity, the soul, consciousness, inner child, inner light is ascending towards to top of your head, touching all your organs. 1,000 petals, lotus opened on your top of your head. Even though you sleep, subconscious is receiving such beautiful things. Same like soul, subconscious will work 24/7. If you feel that sleepy, just do accept. If you feel awake, remember your promise. Yes, I want to take care of myself. If dreamy will come also, same thing will come. Remember your promise. I want love. I am love. I am awaking others. I am awake. Constant, continuous, integrated positive energy, awareness. No more negative patterns. PMA, positive mental attitude. PMA. No matter how many turmoils around me, I want to be positive. No one can disturb you when you take this decision. Now, the inner child is asking higher being, hello, please, with humbleness, inviting the higher being, both united now, both are working for you now, healing. Now come back to your sweet home, that is your chest pit. Keep the inner light there. You don't have to do anything. You have to be stillness, silence, with peace. Energy is interacting with energy. Relax, sweethearts, relax. Unconditional openness. Open that. Put in receive mode. Now I'm going to put Om. Om is a peaceful, nothing to do with religion or anything. Any thoughts will come, just treat them as uninvited guests. Don't give any breakfast. Remember your resolution. I love myself. Relax. Whole body is relaxing, relaxing, relaxing. Matrudevo bhava, Pitrudevo bhava, Acharya Devo bhava, Atiti Devo bhava. Shanti, Shanti, Shanti. Just relax. Inner journey to external journey. To face everything with all is well. I love myself. Remember your promise. Now all of you clap and make it warm and place it on your divine eyes to see that inner light within. With smiles once more. Make it warm and place it on your beautiful divine eyes. See that between the closed eyes and your palm. Inner light. And drop your hands on your lap. Put your index, tip of your index to tip of your thumb. And drop on your lap. Take deep breaths and take 3 ohms, please. Take deep breath. Shanti, Shanti, Shanti. May He protect us all. May He nourish us all. May we work together with pure divine subtle energy. May our ancient wisdom, teachings and studies become enlightening and fruitful. May God bless us all. May peace prevail in our lives, physically, mentally, emotionally, and spiritually. God bless you all. Unity in your body, purity in your mind, divinity in your soul is guiding you, protecting you, directing you for great divine accomplishments. Thank you. Namaste.
So that was a very short, kind of a demo, kind of a presentation because of the time constraints. In fact, we are actually doing a full session tomorrow at Soham Studios in Geneva. If anybody is interested to deeply go into this meditation and learn this, it's a 2-hour workshop from 10 to 12. You can approach me and I'll send you the information. Thank you.
Master Sunita and Dr. Suman. It was an excellent session. I think everyone loved it and will actually follow through what you had taught them in a very short period of time. We are coming to the end of the session and the end of the program. I would like to specifically thank His Excellency, the Ambassador Rajiv Chander, because without his help and support, we would not have been able to organize this program. And I would also like to thank everyone who has come over here all the way, including the speakers and the Indian forum in Geneva. And I would also like to thank Dr. Sumit, who has, I think, during the last days of being here, has spent so much time here. Thank you so much, Dr. Sumit. Thank you for everyone being here. Thank you.